So Gary, one of the things I was struck with in your talk was your mention of technocracy and your concern about it. Can you talk a little bit about that, what that exactly means?
Yeah, what I'm referring to when I'm talking about technocracy is the power base. And within any system, there are those that have power and those that don't. And usually it's a mixture. You'll have power of bureaucrats, you'll have power of experts, but you always should have the power of the people. And when I'm talking about technocracy, what I'm talking about is more and more power being shifted to a very select few experts at the expense of the power of the people.
So like the Ontario Medical System Association, that kind of stuff?
The Ontario Medical Association, but also the local health integrated networks. And for all that those are supposed to be reflective of the communities, when you actually look who's on the board, they're former hospital executives, former executives of community care access centers. In other words, they're not really representative of the general public. And they usually are there to further the agenda of the large institutions.
And that's a different philosophy than the community health centers, right?
Community health centers are very much what I would say based in the power of the people. In fact, the slogan for our community health center is that the members set the agenda. And we really mean that. In other words, we go to our membership, and by membership I mean the people who use our services. We ask them what programs they want us to offer, how they want us to offer the services. We respond to them. Whereas now, the way the system's going, it's like the tail's wagging the dog.
Why does this matter to you?
It matters because deep down, as a Canadian, and I've spent a fair number of years in the United States, I saw what happens when people don't have access to universal health care, how it can destroy families. And as a Canadian, I take enormous pride in the whole notion of universal health care. And I'm deeply concerned that if we don't bring that balance, bring the system back into balance, we could lose something that's very much at the heart and core of what it means to be a Canadian. I mean, imagine being, if we didn't have universal health care, what that would do to the Canadian psyche.
Okay. Thanks very much.
Yeah, good.